right. Hi, everyone. This is Dr. Rao with Meridian Springs Primary Care. We are doing our 10 best ideas to make 2021 your greatest year. We are on week 9 and we have discussed a lot of things so far. We have discussed the physical parts, which is eating, moving, sleeping, breathing, and discussion regarding mental faculty with focus, stress, mindfulness. And now we are discussing hope. So it's a very, it's a vast topic. It has several implications. And I want to welcome Mr. Jesse Moller, who is a certified therapist with Archway Counseling. We're having him back again.
Good to be here. Thanks for asking me back.
Thank you for making the time in your busy schedule. So our goal is to discuss, as I was researching about hope and how it affects our lives, it's huge. The implication of hope affects from clinical spectrum of depression in all age groups, and even your performance at work, your happiness at home, your family life. Hope is all pervasive, and hence it's very, very important that, we make people aware. I think we all know of hope. We have been hopeful about our future, but what it entails, what does hope really mean, and how do you kind of define hope? And then I want to talk about hopelessness. How does one lose hope? And what are the implications of this, which could be very serious? And this is not only important for adults; it's important for children and teenagers, young adults. This is what we're hoping to discuss today. So, hi, Jesse, and thank you for being here again. So as a therapist, how would you define hope or ingredients of hope?
Yeah, great question. I'm really excited about this topic. I think it's a great topic to have a conversation like this about. Also to have a conversation with someone who is a doctor and from a medical standpoint can comment on hope and hopelessness, as well as asking me to come and maybe offer a few thoughts from a counseling or psychological perspective. So hope, what is it? First of all, I think the experience of hope is going to be different for everybody, right? In terms of how you feel hopeful or how you experience hopefulness, it may feel different from one person to the next, or what they think about hope may be different. But I think there's some similarities in terms of what leads people to have hope. Or if they don't experience hopelessness. I think the core piece is experiencing a sense of success with working towards meaningful goals in life, or the planning of goals in life that are meaningful to that person. When people are experiencing being successful with moving forward and doing things that they want to do in life, they feel hopeful, they experience hopefulness. When things get in the way of that, or they feel like they're not having success with working towards goals that are important to them, meaningful or purposeful, they experience hopelessness. I think that's the core.
Yeah, so very interesting. I'm going to just point out the ingredients, what Jesse just mentioned right now. He mentions goals. He mentions how to get from here to there. That means these are goals in the future. So the sense of a person and how he is in his future is an important projection of thought that is involved in the concept of hope. So there is a person, he knows that he's going to be in the future, and he has a goal or several goals that he has in his mind to achieve. And in a simple, so these are the ingredients of a hope in general or regarding certain goals or criteria. So it's very important to understand that the person thinks that there is a future, and he needs to, and he sees himself in his future self that he has achieved certain things. And I think this is a very important concept to understand, especially when we talk about serious aspects of depression and suicide. And then now, Jesse mentions hopelessness and obstacles, which is a very important aspect of what we're going to discuss. So can you elaborate more on the obstacle part?
Yeah, and maybe we should briefly approach that from a human development standpoint. You mentioned about how everyone is potentially at risk of experiencing hopelessness in some way. With children, their sense of hope is really heavily dependent on their attachment to parental figures in their life. If children experience secure attachment, they're less likely to ever experience hopelessness. And for children to experience hopelessness, it's quite significant because children really aren't viewing the world just through their own eyes. They see the world through their parents' eyes, and there's a security that comes with that. There's kind of this buffer or this filter that children experience as long as they have a secure connection with parental figures in their lives. Teenagers now are approaching the time in life where they're beginning to see the world more through their own eyes. And so for teenagers, attachment is important, yes, and that's a challenging time when it comes to experiencing secure relationships with your parents when someone is a teenager. It's normal, it's a part of human development that teenagers begin to question, what is this relationship supposed to be like? Or maybe they're noticing that their parents aren't perfect and do have some flaws and that kind of thing. So there's that component, but then there's also this seeing the world through their own eyes and beginning to establish those goals we were talking about earlier for themselves. And this is the first time in their lives that people are doing this, that they're really thinking about, what do I want to be doing in my life? Who do I want to be? How do I want to be known by others? That's a challenging experience. So that sometimes can, or many times, present some barriers to maintaining a sense of hope in life. And so sometimes teenagers end up experiencing some hopelessness there. And with adults, I think it has very much to do with barriers that they encounter related to this planning and working towards things that they want to achieve in their life or that they want to be, or acting on values that they have that are important. So many things can get in the way of that. It could be that there is a mental health concern sometimes, and it's not the person's fault, but that can get in the way of sometimes feeling like you're able to move forward with those goals. Other things can get in the way. We've just recently gone through going through a pandemic that's affected a lot of people in their home life, in their social life, in work. These are all areas where people have meaningful roles in life, and something like a pandemic, or it could be something else, can interfere with that, and then the person can experience a sense of hopelessness, that they're not able to move forward with being who they want to be or doing what they want to do in their life. A couple other elements that I thought were worth mentioning. With hope, having hope, the person tends to have a sense of power over their circumstances. They can make choices that can affect their future or lead them to realize what they want to realize in their lives. I think also a sense of fairness, or a sense that there is a kind of justice in the world or in their life, is important to have a sense of hope. And then this very important concept of self-determination. People can't have hope if they don't feel like they have the ability or the opportunity to practice making choices for themselves and benefiting from that.
Right. And that is the self-determination is the one that drives a person to achieve the goals. So the self-determination level kind of gives a clue into whether the person is going to be successful or not, or make several attempts. Well, reaching the goal is one aspect of it, but the paths taken or the multiple attempts that the person makes to achieve that goal is what is very important to note. When there is strong hope, the person makes multiple attempts and there is failure, and he or she this person understands that failure or obstacles is a part of the journey, and
Yes.
reroutes themselves to get to there, but not giving up. Or of course, if it's an unattainable goal, if it's 100% known that, okay, I'm going to fly to the moon and I can never do it by myself, that's not a very realistic goal. But of course, when we talk about goals, we want it to be realistic. We want it to be moderately difficult and not too easy or not impossible to achieve. And then comes self-determination that drives the person, takes the person through the journey of reaching that goal.
Right. Yeah. And I think it's so important that when we think about things that are meaningful to us, each of us in our lives, and we're making an effort to accomplish those things, that we look to very workable small actions that we take that cumulatively add up to success with achieving the entire goal, but along the way provide opportunities to experience the smaller successes that can really maintain a sense of hope. So that even if you don't achieve the ultimate goal that you're really working for, well, maybe you've achieved the majority of the journey. And along the way, these smaller steps that you've identified help you to feel like you are making progress and you are acting on that ability to use your self-determination to achieve those goals in life.
And another aspect of it is the obstacle part itself is to, teach children and young adults that you're going to face obstacles while achieving the goals. And it's not uncommon. So, there is a lot of peer pressure, especially amongst young adults looking at Instagram and Facebook about portrayal of life as picture perfect. There is a photo where, the person is probably in a pictures. I guess the photo represents a very unrealistic side of life. But somebody viewing it looks at it as, okay, I'm never going to achieve that look or that amount of status, or it could be an expensive car. But is that a very negative impact on, on hope and on how young minds achieve or look at the goals?
Yeah, I think it is. And I think it's so prevalent nowadays, so much more than before, where before maybe a teenager, if they did, might hear from a friend, that maybe something was said about them or someone that they know is portraying a type of life that's not realistic. But now it's constant. It's on their cell phones 24 hours a day. Yeah. I think it affects someone's, and this is true for adults as well, ability to continue to make commitments to themselves. And it's something that we all do. I think you said this very eloquently earlier, that we face barriers or we experience failures, and maintaining hope means that we've figured out a way to have failures be an opportunity for growth, or at least not a final statement about our ability to make progress in our lives. But this kind of thing where for teenagers at a time where they're fairly vulnerable to peer influences can really be a barrier and can make it difficult to continue to make those commitments to themselves because it seems unattainable. And in fact, it is, right? These images on Instagram or Facebook are so...
It's an instant that is made just for the portrayal of it on the social media. And then I think teenagers and young adults are in their first stages of making that independent attempt to face their obstacles, to face the routes or the pathways they're going to take to achieve those goals.
Absolutely. And peer relationships become so much more important in the teenage years. And that's where a lot of this exchange of ideas that are not realistic and can become expectations for teenagers, unrealistic expectations, takes place.
So in your practice, how do you, what are some of the common scenarios you come across where you have asked questions of hope or I would say symptoms or probably signs of hopelessness? Could we look at it as a spectrum for depression?
I think that hopelessness is always one element of depression. And so I think it can kind of be used as a way to gauge the severity of what someone is experiencing. When someone is very hopeless, or they've been hopeless for a longer period of time, very likely there is more interference with their functioning in life. You know, with relationships and maybe work or school, there's more disruption over time. So, or with more severe hopelessness. Often another element that goes along with hopelessness and depression is a sense of helplessness. And this is a sense of not only are things not going to get better, but I don't have the power to do anything about it right now. I can't get help for this. I can't help myself with this. The combination of those two, hopelessness and helplessness, in my practice, in counseling, I mean, that would really be a warning sign. I would really want to talk to somebody about what they're doing to engage with support. It puts someone at risk of having thoughts of suicide, oftentimes. So that's on the most extreme level, combination of helplessness and hopelessness. If someone experiences hopelessness, does that always mean that they're experiencing depression? Well, no, not necessarily. I think here an element of how long the hopelessness has gone on might be one way to determine or to help someone discover whether they're experiencing depression or whether it's a period of time where they're experiencing some level of hopelessness. Depression involves hopelessness. Depression also involves usually a lack of motivation, kind of that giving up that I think you were referring to earlier, Dr. Rao, where in encountering barriers, and maybe one of those barriers could be a clinical type of depression that has to do with physiology. The person in encountering hopelessness kind of gives up on that idea of continuing to make commitments to keep trying. And they lose motivation to do that, to kind of live a normal life, if you will. Hopelessness doesn't always do that. It doesn't always mean that. One other thing I'd like to mention is sadness and feeling sad. Sadness is not a negative emotion. Sadness is an emotion that people experience when they're experiencing some type of loss in their lives. It's a normal, healthy response to that painful experience of experiencing a loss. Intense sadness is a symptom of depression. And I think people often experience an intense sadness when they're experiencing hopelessness. But sadness in itself is not an indication necessarily that the person is experiencing hopelessness. You can feel very sad, even in the case of very painful grieving of the loss of a loved one who's passed. There can be moments that can feel unbearable, but there can also be glimmers of hope that eventually this will probably get better. Eventually I will probably feel better. So sadness can be very intense and doesn't always mean that the person is experiencing hopelessness or depression.
These are very important, Jesse, you mentioned some of the important aspects, different, overlapping aspects of emotions, related emotions, hopelessness, helplessness, sadness, and how, it can range from simple emotions to, probably recurring emotion to an action, or it can lead to a more serious end of the spectrum, which is risk for suicide. And I think it's very important for people to recognize these. And, if they see their loved ones with symptoms like this, to talk to them to see how bad it is or how severe it is. And, if they're unable to handle it, to recommend seeing a therapist who can delve into the emotions better. And as you said, separate them out to see what is the person at risk of serious mental disorder.
Yeah, it is. It is important. And if it's a family member or a friend, or if it's a teenager and you're a parent, talking to them about what they're experiencing is so important. I think one thing to keep in mind if you do that, or when you need to do that, is that it may be best not to try to get into convincing them that, things can get better, or that if they're experiencing thoughts of suicide and you know that, or you think they might be, to try to convince them that life is worth living. And it's not that that's not something that is important. Of course it is, to know that life is worth living, because it is. But in the moment, it may be difficult for that person to feel supported in their experience in the moment if you're trying to kind of solve the problem for them in that way. Their experience is, if they're experiencing thoughts of suicide, that maybe life is not worth living, or maybe they're in so much pain that they're thinking that maybe something like suicide might be a way out of that difficult experience. So if we suggest that, oh, you have so much to live for, what about this and what about that? The person may actually feel feelings, difficult feelings related to, well, I don't feel that way right now. What's wrong with me for not feeling that way? It may not really help. But yes, talking to them about it. And if you don't know, I would say ask. If you notice that a friend or a family member is experiencing intense sadness and it's prolonged, or maybe they just look like they've never looked to you before, asking them about what they're feeling, asking them very directly, if you're concerned that they might be having thoughts of suicide, asking them that, are you having thoughts of suicide, or are you having thoughts about hurting yourself? And if they say yes, asking them for some clarification and trying to be open and listening to them. It also would be very important to express your love for them. That's always okay. That's always an okay thing to do, and it's a good thing to do. And maybe not only your love, but your care for them, which is a willingness to act on their behalf, or to support them and to try to help them. Maybe staying away from trying to convince them that life is worth living, or that they have a lot to feel good about or be hopeful for at the time. And then if it is a matter of thoughts of suicide, taking steps to connect that person with a professional, a doctor or a mental health professional. It's really important also.
Yeah. And this is the part that as a physician, I have not seen much, because I see patients in my, and I felt that with an experience I had, unfortunately, ended up committing suicide, who, we had evaluations, patient also saw a therapist, but I had no clue what was going on behind the scenes. And it's very difficult. And at that point, I felt like, it's a really hard job to gauge what's going on, what the patient's emotions really are and the actions really are. And that, that bothered me, because it's, we're used to dealing with physical signs and symptoms. When it comes to the human psyche, it's very difficult to peel out the layers and try to understand the person. And of course, I'm not a relative, I'm not living with the person. So it makes it even harder for, a short visit where the patient probably is not inclined to open up.
Yeah, and it's hard for anybody, even family members, to know that that's what somebody is experiencing. Oftentimes, with someone thinking about suicide, as with depression, and I think anytime someone is having thoughts about suicide, it means that depression is present, but that they withdraw from others, or at least are very protective or secretive about what they're really feeling and how bad it really is for them. And they may not be forthcoming. They may not be willing to answer questions openly. So it's hard for anybody to really know. And if anyone suspects that a loved one is having thoughts of suicide, they should ask. Other things potentially to look for might be, certainly if someone is not acting themselves and you hear them talking about things that sound like they're talking about death, or they're talking about suicide, that would be a definite red flag, and you would want to ask that person about that. Occasionally people will begin to give away belongings and that kind of thing, because they've been thinking about suicide. So one of the experiences that someone might have while thinking about suicide, or that may lead them to think about suicide, is feeling like a burden to others, or that they aren't wanted or needed in this life. So sometimes they may begin to give away belongings. Oftentimes they'll withdraw. And if you notice any abrupt changes in someone's mood and you are concerned that they might be having thoughts like that, it's good to ask them. Certainly, if there's a change if someone is a teenager or an adult is drinking and their patterns of alcohol use change, or if there's any substance use that goes along with what you might notice that looks like depression or a really low or difficult experience, that also increases the risk of thoughts of suicide. So it's important to also, in a supportive way, talk to that person about what they're experiencing.
These are so important points. And again, I want to put out a disclaimer that our goal is to discuss these important topics and bring about awareness about the feelings or feelings regarding mental health issues. And if you have any symptoms, or if you identify yourself with any of the symptoms we are discussing, we definitely recommend you to go meet your counselor, or you talk to your doctor, your loved one, and encourage you to get help. But our goal is to spread information and give out information. So this is just to recap a few things what we discussed about hope. As Jesse mentioned that, there are some ingredients of hope that we like to highlight, that, the goals, self-determination, and pathways towards achieving the goals. So these are the important ingredients of hope. And
the smaller successes along the way that help that person to maintain that confidence and making commitments to themselves to continue to work towards these purposeful, meaningful goals in their life. And what that is to each person is very unique and individual. But yeah, having not only the ultimate goals be something that brings the person hope, but the planning that they're in the moment of working towards those things that they really want or want to be about in their lives.
So have multiple plans. If plan A fails, then there's a plan B, there's a plan C. It's as many plans as you need. There is no limitation on your planning. And that's what makes you anti-fragile. That's what prevents the loss of hope and keeps you going. And this is in all respects of life. Kids, of course, when we discuss kids, we discussed about how they depend on the adults. But then when we move to the teenagers and young adults, they are moving out to be to have separate thoughts. Thinking from kind of separating themselves from their parents and having their own thoughts about their goals and achieving them. And again, for the adults, this is again relevant because they need to understand that there is not one single path. They can take multiple paths, and it often takes multiple paths to get to your goal.
It does indeed. And the journey in itself can really bring a sense of hope or increase a sense of hope along the way.
All right. I think, there's a lot of this is a very heavy topic, also more informative. And then I think our goal is to give you tools to bring more joy, bring more hope into your lives. Again, I want to thank Jesse. Jesse, how can anyone reach you?
So they can visit our website, archway-counseling.com. And there is a phone number on that website. There's also an email address if they'd like to email me directly.
And can you talk a little bit about how many counselors and what type of issues you cover?
Yeah, so I think that there are 7 of us now in the practice, and we cover the full range of mental health concerns, from child counseling with younger children, teen counseling, and then individuals, adults, young adults, Also, there are several of us that work with older adults as well and are Medicare providers. We do a lot of couple and family counseling also, or family therapy, couple therapy. Myself and the work that I do, I often have as a focus helping people to strengthen their relationships. And these are the places, these are the sources of the most support and hope and joy in their lives. So it seems to be an effective way to help people with achieving their counseling related goals, to help them with strengthening those relationships. So we also do couple and family therapy.
Awesome. So Jesse has been, I mean, you've helped us a lot in understanding hope. I mean, and today's topic especially, this has been great education. And, I would like to thank you for your expertise. You're taking the time to spend with us.
Thank you, Dr. Rao. It is such a vast topic, and I think it's always the case that when you talk about hope in a setting like this, it will feel heavy actually, because there's this other side of hope, which can be hopelessness, right? But it was really important to talk about, I think. And myself, I feel encouraged and more hopeful by talking about it with you. It also is really encouraging and brings me hope to work with a doctor like you, where you are so attentive to mental health and other concerns that really are so important for the whole person and wellness with someone. So it's really great to have this working relationship with you, Dr. Rao.
Thank you. Thank you, Jesse. We'll have Jesse Moller's information attached to the video and information for Archway Counseling. We're very thankful that and grateful that they are here to help us with our patients.
Dr. Rao, would you also be willing to post the National Suicide Lifeline phone number?
Yes, we will be doing that too, to put in a hotline for anyone that they can reach out, and we will attach that information at the bottom of this video.
And just briefly, there have been some clients and family members of clients who have really benefited from this hotline, and they've given some real positive feedback. I think there are volunteer counselors with this hotline that are ready to answer the phone 24 hours a day. And I've had clients that have needed to use it, and they've had this follow-up relationship with the hotline and with counselors there that they found really supportive. So if you ever have a family member who expresses having thoughts of suicide, it's a great resource. You could make a call with them even the first time to this hotline, and I think you'd find it very personable and supportive. So it's a great resource. Yeah, thank you, Dr. Rao.
Yes, so that number will be attached at the bottom of this video, along with Archway Counseling and their website information. Thank you, everyone.
Thank you.
Jesse.
Bye.